Everyone.
Yeah.
All right. Are we live?
We are now live.
Okay. Well, welcome everyone to the Budget and Finance Committee of the Health Policy Commission. Our responsibilities are to review the budget as proposed by the executive director and the senior staff. This budget has gone through a fairly extensive review by the governor's office and various legislative committees, and we now have to, I guess, give final approval for it to be submitted to the full commission tomorrow. And with that, I'm going to turn the activities over to our executive director, David Sells.
Good afternoon, members of the Administration and Finance Committee. Thank you all for being here. Would note in the Zoom room today with us are other members of HPC staff, John Proctor, who is our Chief Financial Officer, Susan Flanagan Cahill, who is our Deputy General Counsel, and of course, Colleen, Lois, Ellie, and Hannah. Helping to support this. So Stuart, as you said, this is a regular meeting of the ANF committee to provide this committee an update on the HPC's budget. I will note at the top here that the state budget is still under negotiation. So the House and Senate are in conference committee. They are negotiating the final version of the state budget. And so while I plan to present our proposed spending plan based on what is included within the House and Senate versions of the budget, we are not yet at a place to recommend a final budget, understanding that the legislature still needs to finalize the budget and it will go to the governor for final review. So what we're going to present today is where we're at with the current last year's fiscal budget, what we know about for next year's fiscal budget, and provide feedback and questions along the way. And tomorrow, what we're going to do is, unfortunately, we'll just have a simple vote of a continuing resolution that will allow the HPC to continue on at the current budgetary levels until such time as that there is a final state budget that has been signed by the governor. And so that would probably happen at the September board meeting. So we do need that, as we've done in the past, kind of a continuing resolution. So let me first walk through our performance in last fiscal year. So the fiscal year that ended on June 30th, 2022, the FY 2022 budget. So our main source of funding is our main line item appropriation. Last year, on the left-hand side, we received about $10.5 million in the final budget. We're projected to spend at this stage about $9.9 million of that 10.5. So we'll have a very small surplus, and I'll speak a little bit more about that in a second. This funding supports all of our general operations. It supports our payroll, our consultants, our expert contractors, our rent, our administrative operations. As you'll recall, while this number is set in the state budget, ultimately it is funded by an assessment on hospitals, health plans, and ambulatory surgery centers. So the figure is set in the state budget, but then we do an assessment on the healthcare industry to offset the cost of the state cost up to the HPC. So in effect, for the state, the HPC is cost neutral in terms of a budgetary perspective. Last year, we also received additional funding that the legislature earmarked for the Health Policy Commission to support two new investment programs. And so they provided an additional $800,000 to set up two new investment programs, the C4CEN investment program, which is focused on support for substance-exposed newborns and their caregivers, and the Beside investment program, which is focused on improvements in healthcare delivery through the use of doulas to improve maternal health outcomes. So of the 800,000 that we received for these two new programs, we have now launched these two new programs. They are up and running with our awardees. However, it did take some time to set the programs up, to launch the programs. And so we're only projecting to spend about 150 of the 800,000 that was appropriated. And so we are working with the administration and the legislature on a what's called a PAC or a prior appropriate, which would basically move these funds into the next fiscal year so that we can continue to use the appropriated dollars for these two investment programs. So briefly on the next slide, just a visual representation for the main line item. Again, we had about $10.5 million in available funds, expect to expend about 9.9. Some reasons that we tend to always have a little bit of a surplus is I think we engage in some conservative budgeting, such to always hold some funds in case there are unforeseen market transactions, unforeseen dynamics, unforeseen research projects, or other things that really require our attention that may be hard to predict. A lot of our work, especially in the market oversight category, is not within our control. It really is driven by market activities and when providers or health plans are proposing certain activities that trigger our review. But nonetheless, I would say this is actually a smaller surplus than we've had in past years, and I think reflective of a pretty busy year especially in the market oversight space, where we had launched our first performance improvement plan and submitted a comment into the determination of need program on MGB's proposed expansions. So that is really the story for last fiscal year. I would note that the surplus here, as shown, flows back to the healthcare industry, flows back to the assessed entities in the next year. So basically, this becomes a credit for what they would owe us next year for the assessment. So any surplus, any unspent money does basically provide a credit to the assessed entities. So it isn't that the state retains that funding. On the next slide, again, just a little bit more on the assessment. So there are two pieces to the assessment. One is what is appropriated in the budget. You can see that at the top, the 10.3. Additionally, we do assess for the fringe benefits associated with our staff. So this would be our health and retirement benefits, among others. And there is a calculation that the state uses for fringe benefits that is then additionally assessed on the healthcare entities. So the assessed amount is the 13 million. And there you can see that there was a credit. This was the reversion from the previous fiscal year. So that it provides a credit to the assessees. And so the total amount that was assessed by the HPC last fiscal year was the number at the bottom there, 11.1 million. And then in the little box, you can see that the health plans are responsible for 50%, and then the hospitals and ambulatory surgery centers are responsible for the other 50%. I think that's my last slide on last fiscal year. Oh, one more slide to get us up to date here, just on the number of FTEs at the Health Policy Commission. So on the left, you can see by quarter the number of FTEs over our entire 10-year existence. And you can see that we have been tracking between 60 and 65 employees pretty steadily for the last 6 years. On the right-hand side, we break this down by our main departments internally. So the first three are our main policy and research departments. So healthcare transformation and innovation is our department that primarily runs our certification and investment programs. Our market oversight team primarily conducts reviews of market notices and transactions. And our research and cost trends team cuts across a lot of different analyses, but is led by David Auerbach and conducts our data and research work. The next two teams are more internal supports, so internal and external operations, and also finally our great legal office led by Lois Johnson. Embedded within that is our Office of Patient Protection. I think the one thing I would just note here, as I said, the total number has been relatively steady. We do think that we will have some funding to hire a few more positions next year, but really very modestly in the 3 to 4 positions. And the last thing I think I'd say here of note is I think some intentionality of you'll see among the policy teams, they're all pretty evenly sized. We have, you can see that the effort and the amount of people for each of these teams is relatively similar and reflects, I think, a balanced approach to our activities. All right, I think that was now the last slide on last year. So let me pause there and just see if there are any questions or comments or last year before we get into what we expect for the next fiscal year.
Any questions or comments by my fellow commissioners?
David, what's turnover like?
Colleen, you want to tackle that one?
Absolutely. Turnover is really low. We had 3 staff resign in fiscal year 2022. 1 retired, 1 moved abroad, and 1 left for a new opportunity who'd been with us for like 8 years. So it's really low.
Great.
Which we're really proud of and happy of. It's our retention is our #1 goal.
During the Great Resignation, that's great.
Yeah, it didn't happen to us, thank God.
And just one additional question. I know in past years, there've been some issues in collecting on the assessment. Were there any issues in this past year?
I would share that we had some late some entities to be unnamed that were late in compliance. But John, I think we did hit our marks this year. But correct me if I'm wrong.
Yes, we did. We collected a little over $11 million. So the uncollected at this point is about $56,000, and I expect to collect some of that between now and the end of the accounts payable period, which is the end of August. But it's a pretty good collection rate. And for those that we hadn't collected from, almost all of them were surcharge payors, not the providers. So there's something about that side of the group that makes them have more outstanding collections.
So David, there's talk about having the pharmaceutical companies contribute. That's in the next budget if it passes?
Yes, so that is, if that were included in legislative action, that would affect a next year's budget. Yep.
Okay.
Patty?
Well,
yeah, I just, it seems to me in the short time I've been part of the board that your staff is responsible for an ever increasing workload. And my concern is making sure that you have the amount of staff to keep up with those requirements between COVID, between the PIP, between, other, one-off type of things that you're dealing with. I feel like you all must be exhausted. And I just want to make sure that we are, for next year, and this might be premature, really including some monies for additional staffing. I think the fact that you have virtually no turnover is amazing and speaks highly of the work environment, but we want to protect that and make sure that people are being really well compensated for their work and that you have adequate staff to get the work done.
Thank you for that. I think we completely agree. And I would be honest in saying that it has been stretched thin the last 2 years in particular, where we proudly have helped to assist in the Commonwealth's response to the COVID pandemic and have been at the same time seeing really almost a record number of market transactions. The healthcare market is very dynamic right now. So we absolutely agree, and I think are hopeful and plan in next year to be able to kind of right size the balance of the workload so that we're aware of burnout and exhaustion, which I think is not alone to the HPC, and is certainly something that all organizations are really paying attention to. One other thing I would just add around staffing, which I think is another sign of strength for the organization, is that when we have had postings this year, we really do receive a tremendous amount of applications. And so the quantity and quality of the candidates who are excited about the mission-driven work of the HPC continues to be very high.
That's excellent.
Yeah,
Colleen?
Go ahead.
I was going to see if Colleen wanted to add anything.
No, it's not easy for the hiring committees, is all I would say. Is we get hundreds of applications, and it's really, really competitive and difficult to make a decision at the end of the day, which is good news. And I hope that continues. It's thanks to the high profile work. I think that we get so much attention, and then it's our job to make people happy once we get them. But Stuart, were you going to say something?
No, I was just going to talk about the future, but why don't
Yeah.
And why don't we wait and see how you want to talk about the 2023 responsibilities. So, David, I know you were planned on spending a little time on that.
All right, let's move to the next year's spending plan, and we'll show where we're at. So every year, this goes through a multi-step process of the budget. And so originally the governor filed his proposal with a small increase to the HPC to $10.6 million. Subsequently, both the House and the Senate included an identical appropriation of $10.88 million, which was our requested amount for the year. So both the House and Senate have the exact same number in their budget, which is a good thing. That usually means that that's what will come out of the conference committee, and of course then will be reviewed by the governor. So we are presenting today a budget that reflects that 10.88 million, as both the House and Senate have already approved. So what does that increase reflect? On the next slide. Oh, excuse me. In addition to the appropriation, I wanted to note a couple of additional outside sections in both budgets that relate to the HPC. So the outside sections are policy-related sections of the budget, and there are a few here that are of note. So the first is in the House budget. There is a directive to the Health Policy Commission to conduct a specific research report on the impact of COVID-19 on behavioral health related boarding in acute care hospital settings. It also asks the HPC to review behavioral health boarding in other states and recommend best practices to address it. As I think you all know, this is a topical area that we have had a great interest in over the years and have developed, I think, a level of expertise in being able to review the data to understand the trends in behavioral healthcare boarding. And so the House wanted us to expand upon that work with further work and further policy recommendations. The next two ones here in the House budget are less HPC focused. These are activities that the budget directs EOHHS, and in the second or the third kind of arrow here, UMass Amherst, to conduct. The first is a study on prescribing and treatment trends of Massachusetts residents who suffered a fatal overdose. And our role in that study is to provide data as necessary to conduct the work. And then in the third one here, the UMass piece, this is a study on the feasibility of a establishing a School of Health Sciences and Education and Center for Healthcare Workforce Innovation at the Mount Ida campus in Newton. And again, here we are named among a number of state agencies to be consulted in the conduct of that study. And then finally, under the yellow flag here, the Senate did also include a special commission on oral health, and the executive director of the HPC would be a named member of the new commission. So as you'll note, there is differences between the House and Senate here. None of these are in common between the two budgets, so expect that this will be subject to negotiation, and so we don't quite know where these will fall out. But being a member of a commission and being consulted on work is pretty typical for the HPC. I think the only one that would be a little bit more work is the ED boarding study, but again is consistent with some of our expertise to date. So we'll let you know how those shake out. But turning back to the budget request. For next year, the requested funding was for $10.88 million, which represents a 3.5% increase from last year. This is a lower increase than we received in the previous year, and has mentioned that this will not impact the general fund after the assessment. We have been very clear with the Joint Committee on Ways and Means that this requested amount is considered a maintenance of effort request that will allow us to continue to support our current staff and the projects and responsibilities that have been mandated to the HPC. What this request does not include would be the need for additional resources and staff if there is healthcare legislation this session or early next session that would present new mandates, responsibilities, or programs on the HPC. And so the communications have always been open with the Ways and Means committees, and they recognize that if legislation did pass, there would be a willingness to revisit the overall budget for the HPC. And then finally, we are requesting a PAC to continue to move that money forward for the two small investment programs. So as was noted a little bit earlier, this will allow us to maintain levels of efforts across all of our categories of kind of spending. We'll maintain our payroll and allow for additional staff of about 3 to 4 additional staff from where we are today to be hired next year. It maintains at roughly the same amount, the amount that we set aside for consultants and contractors. This is a big part of our spending in the market review areas. And then all of the other smaller categories of general administration, rent and utilities, IT expenses, all of this has been pretty stable from where we were last year. I would note kind of anecdotally, we definitely have experienced some savings from, being in a more virtual or hybrid workplace in some parts of our general administrative operations, as you might imagine, printer ink and paper probably being a big part of that. But we've also had to make not insignificant investments in our IT infrastructure, improving our Wi-Fi capabilities and internet capabilities at the agency, and equipping all of our employees with laptops that can access securely the HPC's data. So on the next slide, so this is really, so that is kind of our proposed spending plan if we were to get the 10.8 in the final budget. It is not that dissimilar from the previous year's budget, but will provide a little bit more flexibility in payroll in particular. And so while we're not going to be able to vote on the budget tomorrow, we do need to vote on this continuing budget resolution that would just allow us to continue to pay payroll until such time as the state budget is complete and we know what our final number is and can vote on a full final budget. On the next slide, let's just move to this and then we can pause for conversation. So I do expect that next year will continue to be a pretty busy year. And here are some of the priorities that we've identified that we do expect will take up a significant portion of our time and energy next year. First of all, being the oversight of our first performance improvement plan. So that will be a new activity for us. We had been previously mandated to report on the state of telehealth and the healthcare workforce. Both of these studies are already underway, but expect that we will finalize these reports in the next year. We continue to have, again, these were previously mandated reports and research reports on the impacts of COVID-19. So we are going to continue to expand on that work. Of course, whenever we get new healthcare mergers or consolidations, those will require our review. And then we have a number of investment programs that are underway. So we'll continue to manage those investment programs. We may receive a drug as referred by Mass Health for a value assessment of the HPC. This process was put in place a number of years ago, but we have not yet received a drug referred from Mass Health to us, but that could come at any time. And then the last bullet here really is around the new investment programs that we just launched. So some unknowns, as always, some known knowns and known unknowns is kind of the name of the game in many cases for our activities. Let's just leave it on the previous slide, Ellie, and can pause here and talk about next year's budget and what we think is going to be on our plate.
Well, as you said, to the extent that we get hit or asked to do much more analysis about price increases and so on, it may require some addition in terms of technical staff. And the fact that the Ways and Means Committee knows that should we get that extra responsibility, there may need to be some extra staff, I think is very important. So I'm glad you've been having those discussions, because if we go into that next level of detail, it will require probably some increase in terms of the capacity of our staff. But I think we're well suited for it. It'll be just a question of getting the right people.
I absolutely agree, Mr. Chairman. And I think with any new responsibilities that come to us, depending on what they are, it may require both new staff with specific expertise, but also, of course, perhaps expert consultants and contractors that we'll need to bring to bear. And I think, I'd like to think we've had a pretty good track record over the 10 years as our responsibilities has grown. We've been able to nimbly take those on and build the capacity necessary to do that.
Exactly. Are there other questions or comments from my fellow commissioners? Is there more you want to talk about, David?
I will just add one color commentary to Patty, your comment earlier. When I presented before the Ways and Means Committee on this budget, one of the chairs of Ways and Means kind of expressed the same concern that you did, and was reflective of the fact that not much has been asked of the HPC, and that they want to make sure that we have the resources necessary to perform our functions at a high level. So just a little color on that commitment that I do think is widely shared. I think this is really it on the budget. I did want to have Colleen just kind of give you kind of a state of the state of the HPC in terms of our office and our staff and how we're doing on return to work. But before I do that, maybe just see if there are any other budgetary questions. So again, the question for tomorrow is really just to the continuing resolution. We may, if something new or unexpected happens with the budget or with other legislative activity, we may need to reconvene this committee. But if it does end up being the number included in the House and Senate versions, I think we'll be well poised to move forward quickly. All right, Colleen, what's going on? How's the HPC doing?
Sure, I think yeah, that's a big question. I think we covered most of it, but I would just say, the state of the staff is quite strong. Reflecting on your discussion, I think that by and large, they want and seek and hope for these new responsibilities. So at the end of legislative sessions, when some of those do not materialize, we deal with much more disappointment than I think you would in a regular workplace, because I think in a regular workplace, folks would be like, no more, please. But that's just not our people. And we're so lucky. We're so lucky that that's the case. So I think, we've had, especially this summer, we've had an incredible class of fellows. We've had 10 graduate students joining us this summer. They come in for 10 weeks. They're spread across all the departments. It gives us so much energy and passion for our work to be working with students at the highest graduate levels. One of the benefits of our continued hybrid work environment is to be able to engage with fellows from across the country. So this year we've had students who are local, but also people who are fully remote, and they're in California, North Carolina, and some cases all over the world. So some of these folks before the pandemic would not have been able to participate in the HBC's program, even though we pay, and we pay very well. So that's the good news from that little pandemic silver lining, if you will, that our fellows are fabulous. And I think most of you will be meeting with them before the end of the summer. I think the only thing I wanted to mention, because I get so many questions about this, is return to the office and when are we going back to the office? So obviously for you all running your own organizations, and continues to be difficult for everyone across the globe, and everyone is dealing with this balance. And we've really just tried our best to meet our people where they're at and where they're most comfortable with COVID, and also trying to really maintain what we think is a really excellent office culture. So we are still continuing with the hybrid workplace model, which the rest of the state is doing as well. And actually our HPC COVID infection rate has been the worst this calendar year than it was throughout the whole pandemic, for reasons that you can probably guess. So thank God that we've kept it hybrid and not rushed back to the office for no reason, because we were able to pivot when folks get sick. So most of the staff are in the office now 1 to 2 days a week. We've been keeping that staggered during COVID. We did implement one all agency day. So 1 day a month, everybody comes in and is all together. And it's been absolutely fabulous to see folks. And if folks are in masks, that they're great. And if they come in and do lunch with us in Post Office Square, that's great too. So it's been really great. We made some modest improvements to accommodate hybrid work. We've invested in some technology improvements to supporting meetings, collaboration among staff in different locations. But our people are really, really good at it, keeping communications no matter where they are. So continuing to shape our plans for the future. We're rolling with COVID, as well as everybody is, taking feedback from staff, taking feedback from leadership. We do surveys, we do feedback groups, we talk to folks all the time. So everyone's valuing the flexibility, I think, more than anything. And the big thing that we're waiting for is to see whether the legislature extends the pandemic policy extensions. Cassandra's probably groaning over there, because we've been waiting for the House and Senate to extend remote and virtual meeting participation, and it expires on Friday. So thank God our meeting of the HPC is July 13th, and this meeting as well, because if they don't do it by this week, we wouldn't have been able to have a virtual meeting. So we're hoping and expecting they extend that at least through this calendar year. Maybe into next year, we'll see. But if that doesn't happen, then that will absolutely change our permanent return to office plans. So I think that's it for the state of the agency. David, back to you. Or any questions? I'm happy to take any questions.
That was great, Colleen. Thank you.
Let's do it.
So nothing else to present today, and look forward to working with this committee and getting the final budget approved through the full board.
So technically, we're just asking tomorrow for a continuing resolution of our budget, with the possibility that in September there will be a final budget.
Correct.
All right. Any final words? If not, I would accept the motion to adjourn. I hear a unanimous decision to adjourn, and so we are adjourned.